Hi, my name is Nene, and I'm the outreach manager at the American Foreign Service Protective Association. And we are here today to talk about the benefits of acupuncture. So hopefully you're in the right place as far as the webinar that you signed up for. ASPA has been holding webinars monthly, and we want to continue doing that, especially during the pandemic, and just still offering information for you to get to know ASPA better, but at the same time, and also keeping you engaged, even though a lot of us are at home right now. Today's session is being recorded, so you will receive the recording within 2 weeks after this event. It will be emailed to the email address that you use to register. So just to let you know, this session is going to be available for you to watch again and again if you would like. There are no attendee videos. This is a Zoom webinar, so that's a little bit different than a Zoom meeting. There are no videos for the attendees, and you're not able to message each other. And we are going to have question and answer, but it is going to be at the end. So please save your questions for the end of the session. There is closed captioning available, and you should be seeing that on your screen. If you do not want the closed captioning, you should be able to go into your options to turn that off if it's interfering with your screen or if you can't see. If you do have any technology issues, if you have any kind of lagging or problems with the technology, you can contact Zoom directly at support.zoom.us. So Zoom can directly give you any kind of support when it comes to technology issues. And once again, due to time restraints, all live questions will be taken at the end. You might see the raise your hand feature on the bottom of your screen. We will not be monitoring those hands for questions, except for maybe a few activities that we're going to do in a few minutes. But besides that, don't feel bad if you raise your hand and we don't get to you, because we're really going to monitor those at the end of the presentation. So with that said, hopefully you can see your raise hand feature, and I'm going to just test it out real quick. And I'm going to ask on a scale of 1 to 10, 10 being, high energy, I'm feeling full for the day. Who here is at least at a 7? A 7 or higher, please raise your hand. Okay, great. We have a lot of people. Oh, wow. A lot of people are at least at a 7. So that's awesome. I'm glad that you're feeling good and that you're mentally with us for this information today. Lower your hand. I have one more quick question. I wanted to, after you lower your hand, I wanted to ask a new question, which is, how many of you are visiting or on this from overseas? How many people are outside the United States right now watching this webinar? Okay, well, I see at least, I'd say 10 or more hands for people outside the US. So thank you. I know some of you might be very late where you're at, so I appreciate you being a part of this webinar today. And then lastly, I do have one more question. I think I said the other one was last, but this is the real last one. Hands down for those who raised for overseas, and then hands up. The last question is, how many people are directly in the DC area? How many people are in Virginia, Maryland, or DC? Please raise your hand. Okay, we have a lot of locals, which is awesome. This should be your lunch break, and we appreciate you spending your lunch break with us. And I see a nice amount of hands of people that are directly in the DC area. So you can lower your hands. And now that I feel like we have enough people in the room, I wanted to give people opportunity to kind of get in the room and get settled for the webinar. I'm going to introduce our keynote speaker for the day. So with us today, we have Rebecca Reynolds, or you can call her Becky, and she is a retired Foreign Service medical provider. She has years of experience as an independent health provider in the US and abroad with her work with the Department of State. And after she retired, she received her acupuncture license in February 2015. And this presentation, she's going to talk about the art of acupuncture and how it can benefit you. I did want to remind people, for those who do have the Foreign Service Benefit Plan, we do cover 50 acupuncture, 50 chiropractic, and 50 massage therapy visits per year. So we wanted to offer this webinar because it's included in your benefit package. Once again, for those who have the Foreign Service Benefit Plan, we wanted you to explore possibly using acupuncture because you do get 50 visits a year, and that's for everyone in the family. So we wanted you to have opportunity to learn more about that service. So with that said, we have Rebecca Reynolds here, and she's going to be our main presenter. And then once again, I'll be back at the end to answer your questions. Take it away, Becky.
Okay. Hi, guys. I'm glad you're out there with us.
Rebecca, you seem to be muted.
Okay. How am I now?
Perfect.
Okay. Well, I'm glad you guys could join me today. I appreciate being here to talk about acupuncture. I love being able to help people without drugs. I just want to mention that the Foreign Service Benefits Plan is about the best insurance plan around, and I've been a member of the Foreign Service Benefits Plan for years. I'm going to talk a little bit about myself because that's what Nene wanted me to do, and then we'll get into the subject at hand. I'm a wellness and senior fitness instructor and a balance coach, an acupuncturist, and a primary care provider at Culmore Clinic in Falls Church, Virginia. You hear my thick Southern accent because I was born and raised, went to college, and then went to work in the hospital I was born in South Georgia. At a certain point, I figured there had to be something different than South Georgia. So I went to work for the government in Indian Health Service on Duck Valley, Shoshone-Paiute Reservation on the Idaho-Nevada line. It's called Big Sky Country because you can see for miles and miles. And once I got over my agoraphobia, I learned to enjoy it, and I learned how to herd cattle on horseback. Eventually, I became a field health director, supervising a few folks on the Sisseton-Wahpeton Sioux Reservation in South Dakota, a few of whom were nurse practitioners. I like the pragmatic approach to patient care that nurse practitioners have, so I decided to leave administration and return to patient care as a nurse practitioner. Then I went from South Dakota to North Dakota, and then from there I joined the Foreign Service, where I served in Africa, Latin America, and Central Asia. In 1989, when I was posted to Sri Lanka, I began studying acupuncture. I called my director to let her know what I was doing, and her response was, "Well, that's great, Becky. Just promise me you're not going to tell anybody else about this." So it was clear to me that the Foreign Service wasn't ready for acupuncture at that point. When I was a little later, when I was posted in City in the 90s, a wonderful USDA vet that was there, Karen Sleater-Shank, I hope she's maybe with us today, who did acupuncture on animals. She helped our Shar-Pei with arthritis. It didn't cure the arthritis, but it made our Shar-Pei able to live with arthritis. In '99, I became deputy of the mid-level providers in continuing education. I organized and taught conferences for locally engaged doctors and nurses, and I taught a few classes at FSI, Safe Haven, new employee orientation, and then of course other duties as assigned. In '04, I retired because my husband had an opportunity to go teach at the Naval War College in Newport, Rhode Island, as the CIA representative. So I continued working in education at Salve Regina University and in primary care. In 2010, I decided if I was ever going to pursue acupuncture, I had to do it. So I finished a master's degree in 2014 and got my national certification. And that's also when I started at Culmore Clinic, where I still work today. In 2015, I started my acupuncture wellness practice. I had no idea how challenging it'd be to run a medical business. Until the pandemic, I taught fitness classes at Fort Myer with several other people, and I've taught wellness classes in Arlington County, and until recently, I was giving COVID vaccines in Arlington County. And that's way more than you ever wanted to know about me. And here I am in 1997. You guys may know the person behind me, Cedric Dumont, that was the medical director for years. Here's what we're doing today. We're going to talk about who gets acupuncture, what does it work for, the types of acupuncture and dry needling there are, what conditions does acupuncture treat, and what do you look for in an acupuncturist? About 40 million people are using acupuncture today. The number varies a little bit from what article or study you're looking at, but this is a demographic looking at 04 to 07 on who was using complementary alternative medicine. I personally use integrative care, meaning I use Western and Eastern medicine together. This is just definitions of acupuncture. It's sometimes referred to as energy medicine. I view it as timeless medicine for these changing, challenging modern times. And this is always a big question. How does acupuncture work? The Chinese believe that illness occurs when there's a blockage or an imbalance in energy or blood. And the Chinese word for energy is qi in the acupuncture context. But the intent of acupuncture is to bring balance to the mind and the body to resolve imbalances and bring the person back to health and resolve the illness. This is a Yan clock. This is your female side here, your dark side or your inner self. And this is Yan. This is your male light side. And you can see 12 noon is high yan, and then midnight is high yin. And this is this is probably why you have more pain at night. This is your inner self coming out. There are 14 acupuncture primary channels that have 360 classical acupuncture points, but there are really more than 1,000 acupuncture points. This is a grid of Chinese ear acupuncture points. In the ear, there's more than 200 acupuncture points. This is a print from the Ming Dynasty of the pericardium channel. We'll use those classical points today. And this point right here at the wrist is the one, if you use the bands for being nauseated or seasick, this is the point that you use, pericardium 6. Acupuncture has been around for a long time. These are Bianlian stones from the New Stone Age that were used for acupuncture, mainly bleeding. Acupuncture is based on 5 elements and 8 principles. The 5 elements are fire, earth, metal, water, and wood. The 8 principles are yin, yang, heat, cold, excess, deficiency, and interior, exterior. And you know, you can, with the interior, exterior, when you're getting chills, when you're getting sick, that's something going from exterior to interior if you're about to get sick. This was actually where I went to acupuncture school, and this is the Skagit River, and the mountain in the back with the glaciers is Mount Baker. Acupuncture works together with the mind and body to bring balance, as the mountains work with the rivers to bring balance in nature. This is a modern day acupuncture needle. In the past, bamboo shoots were used, that sort of thing. This is an acupuncture needle, which you can't really see very well, but we will go over here Nene, there's a question in the chat thing. This is a comparison of a modern medical needle and an acupuncture needle. And I just want to show you, let's see if I can get this right here. I'm just going to insert the acupuncture needle. I'm putting it into a classical acupuncture point. I use free needling. So there is the acupuncture point inserted, and it's a great point. This is called joining rivers or something like that, or hiku. It's a big influential point. And actually you can use it in acupressure as well when your boss is telling you something you don't want to hear. These are different styles of acupuncture. 5-element is the British style, or the Wolseley system. Japanese acupuncture is the most gentle. Korean acupuncture and Vietnamese and French acupuncture is pretty aggressive. Chinese acupuncture is somewhere in between. Dry needling is the physical therapist acupuncture. That's a very localized acupuncture that's pretty aggressive with pretty big needles. They don't use distal points or channels, but they do use classical acupuncture points. Community acupuncture is group acupuncture. An organization in the States is People's Organization of Community Acupuncture. It's affordable, but it's not a great idea during COVID. Auricular acupuncture or ear acupuncture is battlefield acupuncture and the NADA protocols that's used for drug and alcohol withdrawal. And as I mentioned earlier, I use an Eastern and Western approach to care. And I use Japanese, I use dry needling, I use whatever is going to be right for the person I'm dealing with. There's a lot of acupuncture research. The World Health Organization found that acupuncture is good for pain relief, protecting against infections, and regulating various physiological functions. In other words, that's medicalese for everything else. But something that's a little more recent, in 2016, the Mayo Clinic did a meta-analysis of 105 studies with 16,000 participants, and that showed to be effective for pain management for knee problems. Let's see here. This dizzying slide is also from the World Health Organization. I'll just run down some of these things. I found acupuncture to be great for helping with allergies, menstrual problems, GI problems, facial pain. I had one patient that had post-herpetic trigeminal pain here to the point that she had pushed out a tooth. The pain was really severe, and her pain was resolved by about 70 or 80% on the first treatment and resolved completely with the next treatment. Headaches, this is more of a chronic condition, and I have one patient, once she gets a migraine, she'll call me up every few months to get treated. Then OBGYN stuff, somewhere here, there's painful periods, that kind of thing. Helping put a baby into a normal position. To change a breech baby, you need to start treating the person between 34 to 38 weeks gestation. And of course, morning sickness and knee pain, etc. Now, this is always a question. Does acupuncture hurt? No, not like getting your blood drawn or getting a flu shot. If you have some tenderness at the acupuncture site, I'll just go to another site. Sometimes you don't even feel the needle going into place. I hope my husband gets the phone here. So anyway, you may feel some tingling or warmth or heaviness at the site. Some people find acupuncture relaxing and may fall asleep before I finish getting the needles in. This is always a question. If I don't get relief on the first treatment, should I get acupuncture again? And the answer is yes. It doesn't work like Western medicine, where 1 and 1 always equals 2, or like taking 2 Motrin for a headache. 1 and 1 can equal 2. Every once in a while, 1 and 1 can equal 5 or 10, and the person's problem can be completely resolved. Or sometimes you get no response at all. But generally speaking, for things like back pain, plantar fasciitis, you need to treat somebody routinely for a few weeks. Migraine headaches tend to need treatment according to the person. Sometimes it's every 2 weeks, sometimes it's every few months. As one of my patients' husbands said, he was a retired naval commander. I didn't think this voodoo was going to work, but it does. But it's not voodoo. It's neuroplasticity and opening up energy pathways. Now, there's always the person that hates needles, no matter what size they are. There are alternatives. We can use ear seeds, and this is an ear seed that you put on those acupuncture points that I showed you earlier. There's also acupressure with or without a probe and with or without essential oils. There's Japanese iron cords. There's also moxa. Moxa comes in a couple of different forms. This is moxa. I don't know if you can see that or not. And this is also, this is the kind of moxa I like to use. This is ibuki moxa that I use for infertility and turning a breech baby. We also have Japanese tacks. This is a Japanese tack, and you can't see it, but there's a little tiny microscopic needle on there that you can use to put in, and there it is, and that happens to be a point for helping back pain. You can also use lasers. This is a laser. I'm sorry, I'm having trouble here with this. And now I'll just turn the laser on so maybe you can see that. So that's a laser you can use at an acupuncture point. There's also cupping. This is the kind of cupping I like to do. I use Japanese cups and suction cups. I don't use fire cups because there is a little bit of a fire hazard with fire cups. I use I don't use much Twana. I do use Sotai, that's a Japanese system moving away from pain. And I do use electrostimulation without needles. Is acupuncture a perfect fix that's good for everything, for everybody? No, it's not. It's great for some people though. But if you have acute problems like difficulty breathing, chest pain, bleeding, acute trauma, the acupuncturist is not who you need to see. Is acupuncture worth trying, especially like for OB problems or chronic conditions? Absolutely. This is a little redundant. This is what I found acupuncture to be good for, but I went over that on the other slide. I just want to mention acupuncture does improve fertility. This sweet little baby was a byproduct of me treating somebody that had some depression and other issues and bad menstrual cramps. And it worked very effectively. It was not a disastrous result because we have wonderful little Zach here. But now I make a point of mentioning that fertility helps, that acupuncture does help with fertility. We don't want any surprises. So what do you look for in an acupuncturist? You look for somebody with a master's or doctorate level degree. You look for somebody that's nationally certified. The states vary widely on licensing requirements. Maryland does not require national certification. Some doctors and physical therapists and chiropractors provide acupuncture. The doctors and the chiropractors have had about 200 hours of training. The physical therapists have had about 50 hours of training. And you know, as long as they're effective and safe and competent, and you get relief, that's the only important thing. What's most important is that you look for somebody you like and that you can understand and that you feel comfortable with, especially for you guys overseas, not so much here. You want to always ask about needles. Some things to avoid: somebody that wants you to buy some kind of package of treatments on your first visit, someone that's doing a lot of rejuvenation stuff and injections and those sorts of things, or somebody that says they can cure everything. This is just a little demographic of 2021 on where the acupuncturists are. You can certainly see that there's a lot of acupuncturists on the West Coast, but there's a few surprises. I would not have thought Texas would have had a lot of acupuncturists. And Florida and New York also have, and Colorado have a lot of acupuncturists. Virginia's somewhere in between, and North Dakota has 13. A little bit about how you get ready for a treatment of acupuncture: wear loose fitting clothes, eat a little bit, drink water, and speak up if you're uncomfortable, and no beer for lunch. After you have an acupuncture treatment, you need to drink plenty of water. If you have a lot of toxins in your system, you might have a loose stool, and ask any questions you might have. If there's any problems or anything like that. And I just want to mention, you may not feel the full effect of an acupuncture treatment till a day or two later. This is me during the midst of COVID. I saw people using PPE. And what's changed? Infection control and air purifiers have changed. And this is me the other day, all disposable, all mask, and I want my patients, if at all possible, to be vaccinated. That is not always possible. I have treated some 10-year-olds for long haul COVID. Once the needles are in, the patient can take the mask off in the room, in the treatment room. These are resources for if you want more information, and we'll come back to some of this information. Here's some videos on acupuncture. We're actually going to see the video, Miracle of Tilly. I do apologize for the audio on that. There is animal acupuncture that's done by vets, and this is a chart of animal acupuncture points. And I just want to mention a few things about Tilly. And this is an Australian video, and the vet's voice is very quiet, unlike mine. So I'll just interject a few things as we go along here.
This is Tilly, an 8-month-old pug brought into the surgery 48 hours ago, about 6 hours after having been hit by a car. Sudden collapse at that 6-hour time. Stopped breathing, close enough to being dead. So had conventional resuscitation. 48 hours later, she's fully conscious, but virtually unable to move. She can swallow liquids if they're put into her mouth, but can't chew, can't lap, can't stand at all. Try to give her some acupuncture.
So I'll just go over what he said. She was in a motor vehicle accident and had to be revived. And this is at about 48 hours out, and she was very nearly dead. And now he's putting in some needles. He's not putting the needles into the nerve. but she's responding to the needles. And you can, in a minute, you'll be able to see her movement clearly. Her paw is shaking a little. This is from the acupuncture. So you can see she's moving a bit now and she's responding some.
This is 24 hours since the first treatment with acupuncture. She's obviously still not real well, but she can look around, move her head a little bit. She can swallow. She's got a little bit of strength in the legs.
So in other words, she's doing better. She can actually swallow now. She wasn't able to do that before. And she has just a little bit of muscle control. So of course, this shows that she can swallow. And pugs are a very food-driven breed. We'll talk a little bit more about the breed in a minute.
First time Chili's fed herself. Up until now, I've had to literally push the food underneath her lips to get her to eat.
Okay, so it's now 2 weeks since her accident. Chili's a lot brighter, lifts her head, wags her tail, a lot of strength in her legs, although obviously still no balance yet. She's progressively eating and drinking well, also her leg back, responsive as well, the other legs. She's just about able to sit herself up now.
So she can wag her tail and she responds to stimuli and she's got more motor control. This is at about 2 weeks out.
About this time, Tilly was taken to a couple of other vets in the district who were adamant that she should be euthanized because she'd never walk again and would have absolutely no quality of life. So the owners agreed to give Tilly to us to keep at our home and see what we could do for her for a couple of months at no charge to them. I also decided to invest in an electroacupuncture unit because that should give Tilly the best chance of nerve regeneration.
You need to see this, Alan. You need to see what she's doing. Alan.
So
She's walking. She's trying to walk. You need to stop making tea and come and see this.
I just want to mention pugs make a lot of strange sounds. So those are not sounds of pain, just strange pug sounds. So see her wagging her tail and moving. So she's just about completely cured at about 10 weeks out.
Girl. Move it fast. Move it fast. Tilly, come on. Growing toenails.
she stopped dragging.
Yeah, that's a good sign. If she's growing her nails, then she's lifting her feet.
So she's about to be returned to her home now. Okay. So I love pugs. So, but anyway, so we'll just talk a little bit more about acupuncture. Let's see. This is one of my patients. Kind of ignore what she says about me and listen to what she's saying about what acupuncture has done for her.
Hi, my name is Deborah Hamilton, and I'm here to give a testimonial for acupuncture treatment from Rebecca Reynolds. I met Becky about 5 years ago through my massage therapist, and I have tried acupuncture over the years with different practitioners, and I found Becky's approach to be more useful for me because she uses a more holistic approach, including essential oils, cupping, acupuncture, as well as other kinds of treatments, depending on what your problems are. For me, she has been working over a period of time to lower my reactivity to changes in the barometric pressure that cause sinus and pressure headaches and other muscle aches. And it's been very effective. I feel better now than I ever have. And I highly recommend that you give acupuncture a try with Becky. Thank you.
Okay. But anyway, so Deb has had a problem with sinuses and allergies and those kinds of things, and acupuncture has worked well for her. This is just my contact information. Again, this is the NACOM organization, how to find an acupuncturist that's certified in your area. This is the website for the Acupuncture Society of Virginia to find an acupuncturist in Virginia. There is a European Traditional Medicine Association as well, European Chinese Medicine Association. Also, when you're overseas, check with your health unit, ask your RMO and the folks in your health unit to help you find an acupuncturist. Just be warned, maybe not everybody's open to acupuncture, but I'm thinking more will be these days. So we're to your questions.
Okay, great. Hopefully everybody can hear me. You can hear me, Rebecca?
Yeah, you're good.
Okay, awesome. Thank you for that information. I did want to, for those of you who have questions, we already have a few in, but please keep sending them, and we're about to take them in 30 seconds. But I did want to just go back to the video on Tilly. So
Yeah.
just to summarize, she was about to be put down, right?
Well, she needed to be revived, and she's like an 8-week-old pug or 8-month-old pug, and she was unconscious. And at about 2 weeks or so, they consulted another vet, and they recommended that she be euthanized. And but then they kept treating her, and the Australian vet kept her and did intensive treatment with her for a few weeks, and she was completely recovered in about 10 weeks.
Wow. So going from being put down to running around the park, that's a big transformation. And the only thing she had was acupuncture?
I'm not sure on that. Electroacupuncture though, so.
Okay, that's an awesome story. I can't imagine what it does for human beings. But I want to thank you, Becky. That was great information. We do have a lot of questions coming in, so let's try to get to them. Actually, the first one that we got is acupuncture effective on tendinitis? Tinnitus, I believe.
Yeah.
Is that
tendinitis? Yes.
What? Okay. Yeah. Well, there you go.
It usually takes, it's going to take a few treatments, but absolutely. And according to to the person, they may work better with electrostimulation, but it just varies with the person.
Okay, we have a question. How long does an acupuncture cure last?
Well, that varies. Sometimes forever. Sometimes people have to come back in, like when I've been dealing with people with neuropathy. I'm dealing with an 85-year-old that comes in about every 6 weeks for a little tune-up. So people need tune-ups somewhere between once a week or once every 2 weeks to every 6 months. It varies with the person.
Okay, great. So what does RMO stand for?
RMO, Regional Medical Officer. Sorry.
Okay, and that's something when you're overseas, when you're
Right.
stationed overseas?
Yeah, the State Department, State Med has a system of medical providers, and you have regional medical officers. I worked with regional medical officers. They would come in periodic. Sometimes they would be posted at post. Sometimes they would be posted away. Like when I was in Yaoundé, Cameroon, my regional medical officer was in Nigeria.
Okay, great. And somebody made a comment. They said they used acupuncture on their dog and it was amazing. So that was just a comment that we had.
Yeah, I just wanted to say, just like humans, acupuncture is great for some animals, not others. And the same is true for humans.
Good point. Good point. I'm going to combine two questions. We have someone who asks, is acupuncture good for quitting smoking? And also, is it effective for weight loss and exercise?
Yes, but you have to come up with a plan for both, because those needles won't do much unless you have a plan for stopping smoking, and you have to be ready to quit smoking. And the same thing for weight loss. You know, a couple of needles will not make you lose 50 pounds. You have to do the exercise and all the other things too. But acupuncture can help.
Wonderful, wonderful. And okay, we got a lot coming in. Is it effective on insomnia, and also for stress?
Absolutely. In fact, I just realized I had my little stress needles up here in my head now, and I can take them out. Yes.
Okay, great. And we have a couple questions when it comes to training to become an acupuncturist. How long is the training, and what do you think of online training?
I think you can do, you have to do some hands-on. I think online you can do some things. And I think as a career, I love helping people without drugs. But if you're looking at a way to make money, I can't. The only way to make money in acupuncture is to go from room to room to room to room. I can't do that. You know, I can see about like 10 people a week, and that's what I have energy for. But, you know, if you're young and you don't mind being paid not so well, acupuncture can be a good career. So I hope I answered the question.
Absolutely. We did have someone who asked about FSBP's coverage. Yes, we cover 50 acupuncture visits per year, and that's for every covered family member. So if you do have the Foreign Service Benefit Plan, you do get 50 acupuncture visits included in your health plan, along with 50 chiropractic and 50 massage therapy for everybody in the family. Couple more questions. Oh, this goes back to training. So this person lives in New Hampshire, and they want to look into becoming an acupuncturist. Do you know who or where they would get training, go about getting training or certified?
I'm not sure about New Hampshire. I know Boston has the New England School of Acupuncture, but you could certainly go online and look. And actually, Connecticut has a new acupuncture school as well. When you're looking at acupuncture schools, you want to make sure that that school's accredited.
Okay, wonderful. So just to clarify, the person before that we thought was tendonitis, and we did get some questions about tendonitis, but there's also a question about tinnitus, which is ringing in the ears.
Yes, it's helpful for that. Tinnitus is actually a neurological issue, and it can be helpful for tinnitus.
Tinnitus. Okay, well, that's even better. Yeah, so okay, can help with ringing in the ears. I think you already talked about diet and exercise that can help with weight loss. Anything else you want to say about that? There was a couple people that asked about weight loss.
There's, yeah, and looking at the Chinese theory on how to eat is also a good way to approach weight loss. And, you know, the Chinese say, eat breakfast like an emperor, lunch like a merchant, and dinner like a peasant. That's also helpful with weight loss. And exercising before you eat.
Okay, wonderful. And also, does acupuncture help improve balance?
Yes, you have to work on that. And sometimes if you've got a lot of balance problems, you need to be working with a physical therapist as well. So you need to do at-home balance exercises.
Okay, great. Someone says, I scheduled for a knee replacement surgery in mid-August and would like to try acupuncture for pain management. How soon can I start after surgery?
You can start as probably within several days.
Okay. So several days after your surgery sounds like you're good to go.
Mm-hmm.
Should you start your treatment for should you start acupuncture treatment for allergies before allergy season begins, or how far before?
Yes, you know, you will with acupuncture with allergies and sinuses. That's more of a chronic thing, and you should start before allergy season.
Okay, great. If one has an auto accident and experiences trauma, fear of driving, can acupuncture help with that?
It's certainly good for PTSD, and that sounds like that's what the person's having.
Mm-hmm.
And that's actually you know, that's understandable that person feels that way.
Absolutely. We have, is dog acupuncture a specialty, or would any acupuncturist be able to do it?
No, the vets have that cornered. They need to go to a vet that's actually certified in veterinary acupuncture.
And just to be clear, FSBP, Foreign Service Benefit Plan, covers people that are getting acupuncture. So you're 50 visits a year. And okay, what is the average price of a session? The Foreign Service Benefit Plan covers up to $60. So someone's asking the average price of a session, and maybe it has to do with what kind of treatment you're getting, but I don't know if you can address that.
Sure. You know, that's kind of all over the map. I'm cheap. My first visit, because I have to do a health intake and that kind of stuff. So the health history is $60 and the treatment's $85.
Okay, great. We can take a few more. Oh, go ahead.
It can cost up to $500 for the first visit. That's what I was going to say.
Oh, okay. Got you. So it can vary.
As I say, I'm cheap. So
I understand. Okay, I have someone here, and we can only take a few more. If we can't get to your question, you can email it to outreach@aspa.org. And we do have another question. Someone says, I have a lot of headaches, not migraines, but headaches almost every other day. I've been told my spine is to straight, and I can only exercise to get rid of my headaches. This will build up the muscles for my neck. So I guess can acupuncture help with general headaches, and then I guess to build up the muscles in her neck?
Yeah, there's also a good book by Robin McKenzie called How to Take Care of Your Own Neck. I recommend you go on Amazon and get that book.
Okay, great. And someone asked, this is more of a me question about FSBP's coverage. You get 50 of each service. So there's 50 acupuncture visits, 50 massage therapy visits, 50 chiropractic, and that's for each member of the family. Each family member gets 150 total. 50 of each service, not 50 of a combined. I hope that helps the person who asked about that. And someone also asks, if FSBP, do you need a referral from a doctor first? And that's no. So you don't need a referral for the massage therapist, the acupuncturist, or the chiropractor. You can just pick any licensed professional and you can see them. Is acupuncture, this is for you, Becky, is it effective for irritable bowel syndrome?
It helps. You have to do some other things with irritable bowel, like work on your diet, but it can certainly help. I actually have had a lot of luck, let's see, with peppermint, believe it or not. doTERRA does a peppermint perlet. That helps, and prebiotics and probiotics also help, and digestive enzymes, and acupuncture.
Okay, great. And for headaches, do you only have to go when you have the headaches?
It varies with the person and how often do you have headaches. Like my one lady, she's a migraine lady. She'll get in touch with me every 2 to 6 months. It varies with your migraine pattern.
Okay, great. And does acupuncture help with ADHD, so attention deficit disorder?
Yeah, but you need to be working with, your own, you need to work with somebody that's done neuropsych testing to make sure that person's got the accommodations they need also with ADHD.
Okay, we're going to take a few more because we're running out of time. Does the acupuncturist diagnose issues through your wrist?
Do we diagnose issues through the wrist?
Through, I guess if you're having wrist issues.
Yeah, so, certainly I can pick up if, say, you have a Dupuytren's contracture or whatever. I don't know other acupuncturist skills levels, but I'm a nurse practitioner too, so I can pretty much make a guesstimate on what's going on. But if we're not having much success, you go off to the ortho guy, and you might need to have surgery, say if you've got carpal tunnel, and I can certainly diagnose that.
Awesome. Will acupuncture help mitigate hip pain therapy, preventing hip surgery?
Well, I'm actually trying to work with somebody with that right now. She's had hip pain. She's had one hip replacement, and we're trying to keep her from having a second hip replacement on her other side. So, and I'm having some success. I've only been working with her less than a week, but she's responding well, and she is walking without a cane now.
Wonderful. And actually, this is kind of related. Someone says, I'm fairly young, and due to my time in the military and athletic lifestyle, my surgeon is saying that I have to replace my left hip soon. Will acupuncture work for my pain of bone on bone to prevent surgery?
We'd have to see. It's according to the person, maybe.
Okay. So these other comments, somebody said that acupuncture helped their cat, and something about the next day acupuncture worked. And then as far as someone asked about insurance again, if you have the foreign service benefit plan, I can't speak for any other insurance. If you're not the foreign service benefit plan, if you're not one of our members, however, the foreign service benefit plan does cover 50 acupuncture visits per year and 50 chiro and 50 massage therapy for all covered family members.
I don't know if there are other people from other programs, but I will say that it is all over the map and what other insurances do. And I'm not going to call names about people, but the companies that have been tough to deal with. But some folks say they cover acupuncture, but it's really minimal. and what they do cover. It's like they only cover for pain, not allergies or whatever.
Okay, and okay, this is our
You're frozen. Nina, you're frozen.
last one. Does Acupuncturist claim or work with insurance? May be able to submit it for you. But we do need to wrap up. If you do have any more questions specifically, and if it's about acupuncture or if it's about coverage, you can email outreach@aspa.org. That's outreach, OUTREACH @AFSPA.org. So Rebecca, if we can go to the last slide.
Right. I wanted to say that I give somebody a super bill so they can get reimbursement from ASPA or Blue Cross Blue Shield or United or whoever.
Okay, great. So thank you for addressing that. This has been great. The recording will be available. Once again, it's going to be emailed within the next 2 weeks. So please be looking at your email for the recording of today's session. We want to thank Rebecca Reynolds, for presenting today. This is great information, and I love the questions from the audience. Thank you for participating actively. The slides will be emailed within 2 weeks, and be also looking out for our next webinar. We're trying to do them every month, so you should be getting invitations soon. Somebody said, thank you so much. This has been a great webinar. So Elizabeth Lewis said that. So Rebecca, good job. And if you have any questions about FSBP, especially for those who don't have the plan, you can visit aspa.org/virtual packet, and you can see our summary of benefits, our full brochure, and get information about all of our products and services. I want to thank you for spending your lunch with us, and there will be a survey. Please fill out the survey. It'll be emailed to you as soon as you disconnect, and your feedback is very valuable for us improving future sessions. Have a great afternoon. Bye.